Good day, everyone. I am your host, Lee Judge, and welcome to today's webinar entitled How to Engage and Retain Customers, brought to you by Jacada. Our presenter today is Clay Davis, Healthcare Program Manager at Jacada. Today, we will demonstrate how healthcare payers can leverage customer engagement strategies from industries like retail and financial services to build a growing and loyal customer base. Following the presentation, there will be a question and answer session, so please feel free to type your questions in the Q&A window at any time. Also, as a note, to protect the privacy of our attendees, only your name will appear in the attendee window. So let's begin. The presentation is all yours, Clay.
Hi, thank you, Lee, and thank you everyone for joining today. It's a real privilege to speak with you today, and I'm looking forward to sharing some of the insights that we've gained through our years of working with healthcare companies. Before we start, I thought I'd share just a bit of background about myself. My name is Clay Davis, and I am the Healthcare Program Manager here at Jacada. I've been with the company for about 5 years, and during that time, I've helped a number of companies in the healthcare space implement innovative solutions, and even going back before my time here at Jacada. So just to give you a little bit of insight around who Jacada is, we are a software technology company. We were founded in 1990, so we've been doing this for about 24, 25 years. And our focus is on primarily delivering customer experience and customer service solutions for the verticals like telecom, healthcare, financial services, and the retail industries as an example. So we're specialists in the space. We're not just technology. We actually understand customer service. We understand contact centers. We understand customer self-service. So I thought it would make sense to kind of set the stage for what we're going to be talking about today by actually putting up some of the challenges that we know that healthcare payers face. I've listed some of these up here, and hopefully some of these resonate for you. And as we progress through the presentation today, we're actually going to see some specific solutions for how we want to address each of those. We're going to start at a very high level and tackle some very big problems, and then we're going to kind of decompose and get more tactical as we go. So at this point, I want to pause for just a moment and maybe just pose the question that each of you are asking, or perhaps you're asking is, does this apply to me? Is this relevant? Why do I want to watch the remainder of this webinar? In short, so what? Okay, you've got some products, you've listed some problems. Why does that bother me one way or the other? To answer that question, I'm going to show you two numbers, 82% and 56%. I don't know if any of you have started thinking what those numbers actually entail, but I'll share with you what they mean. They represent the customer experience score for different vertical industries. And I'm sorry to report that healthcare insurance is at the bottom of the heap with an average score of roughly around 56%, whereas retailers, which most companies, most of us in the industry kind of hold them up as one of the better benchmarks for how to service customers, is up at 82%. So the bottom line is you should care about these things. How you deliver great customer service to your members and to your providers is absolutely critical. And the reason being is a trend that we've noticed, and it's come and it's hitting in several areas, and it's called consumerization. Probably you've heard that. Perhaps you weren't quite clear why it was relevant. So let's start by actually understanding what consumerization is. Consumerization is the growing tendency for new information technology to emerge first in the, nobody wants me to stand up here and read you a slide. That is absolutely not what consumerization is about. Consumerization is about just one real key aspect. Customer is the king. Customer is the queen. In short, your customers want to interact with you on their terms. They want to determine who they speak with. They want to determine when they call, how they contact you, what channel they use, who, when, how, what. All the traditional W questions all come into play. You can think of them as king. I even read an article that implies that they think of themselves as gods. So the important takeaway here is your customers in the healthcare space are wanting to interact with you on their terms. So There are a lot of reasons why this has come into being. I mean, you can see some of the demographic factors here, some of the mobility and the social legislation. Regardless of where you fall on the different trends and why healthcare reform has come, there are a lot of factors that are coming into play that are driving this consumerization. And the key is customers expect to interact with you in this fashion, and they're going to be looking for companies that provide this type of hand-holding and this type of personalized interaction. What does that mean for you as a result of some of the legislative changes and some of the other market forces? Many of our healthcare payers are now having to compete directly and with customers, or not compete with, but are actually trying to attract and sell and retain directly to customers where used to they didn't have to. The companies that are going to succeed going forward are the ones that learn how to market to and sell and service and retain individuals, not necessarily the corporate benefits representative or someone else. Group insurance will always be there, but selling and marketing to individuals is becoming more and more important. So in order to kind of launch us into this process, I thought it would make sense for us to reference what retail. We've already held them up as the standard that we want to use as a basis for comparison. So we're going to take some of the lessons learned from the retail industry. And if I know enough about healthcare, I know probably what some of you are thinking right now. That's all well and good, but healthcare is not retail, and it's not so easy. As a matter of fact, it's extremely complex. The word map here doesn't even do justice to all the different factors that come into play that really make trying to provide effective healthcare service and insurance coverage to your members an easy proposition. It's anything but. And in fact, you've got changing demographics, you've got younger populations coming in, you've got older populations growing, and all the while you're trying to connect them back to your organization in some meaningful way. So Jacada is here to help quieten down some of the noise and help you connect the dots and create this full life cycle customer service that perhaps you've heard of and that we're going to be talking about a little bit more today. So what does that mean in practice? So full life cycle customer service is a very big term, and it's comprised of a lot of things. I've listed just a few of these here, kind of in ascending order in terms of how complex and how much of the problem they actually hope to break off and work with. So in this case, each of these things have been brought to bear for our retail friends, and they can talk to you at length about why all of these things are necessary in order to provide that full life cycle customer service. And yes, it is coming to healthcare as well, and you guys need to be preparing for it, as I'm sure you already are. And in fact, it even applies to my industry. If you've ever heard the term cloud computing, and if you have any technology bent, then you know that's customers saying, we want to buy and use software on our terms, not on your terms. Okay? So because this is such a big topic, and because I couldn't hope to do justice to all of it in such a short webinar, I decided to pick one, and that is proactive customer service, because I think we can touch a lot of relevant bases in that process, and we can really start to hone in on what are some of the things that you can potentially be doing to help drive your customer experience. So we're going to look at proactive customer service, and specifically, we're going to look at how Jacada can help enable that process. We're going to do that by taking the process through from start to finish. We're actually going to explore a full life cycle of a particular type of interaction, if you will, and we're going to see some of the different technologies come into play. I'm going to start with the premise that you want to reach out and connect with your customer. And so using Jacada workflow, you could potentially design the rules that would determine when you want to reach out and proactively notify your customer, your member, your provider, whomever, however you want to define that. You want to proactively reach out to them. So how do you do that? You define the rules, and then you send an SMS proactive message to that individual. And right now I want to stop and pretty much address an issue that I suspect has already come up with some of you. Perhaps you've already gone down this path. Perhaps you've taken the concept of sending SMS messages out. You've spoken with your compliance team and whoever is responsible for your PHI and HIPAA resoundingly said no. It's a non-secure channel. There's no point in sending out private healthcare information. We'll get our wrist slapped, or actually we'll get much more than a wrist slap. We'll get hammered over this. So I understand your concerns. A couple points I want to make here now. One is these proactive notifications do not necessarily have to be SMS text. They can be email, they can be other channels as well, maybe something we've not thought of in the future. But more importantly, Jacada is not asking you to send any private information across the SMS channel. What we're suggesting is you notify your member through whatever channel and on whatever device they prefer, and then we begin a secure interaction using our technology, using traditional security techniques such as secure socket layers, all the different things that you hear the techies throw out to make sure that, authentication, that you're dealing with the right person, that information is encrypted. All of those things Jacada is handling as we manage the interaction for you, but still doing it based on your business logic written by your business users. Okay, so Jacada is managing that interaction. Here again, it's on a mobile device, maybe it's in a social channel, maybe it's on your web self-service site. And here's an important point. If you don't catch anything else I say today, please pay attention to this. When the time comes, you've not given a complete customer service experience if you give them a self-service option and you do not give them the option to seamlessly transition that process back to a customer service representative. I'm sure each of you have had a time when you've been on a website, you've been on a mobile device, maybe you were ready to buy a service or a product, maybe you were ready to sign up for even something like this webinar, and at the last moment you had misgivings, and you wanted to talk to someone just to answer that last one or two questions, and yet you knew if you picked up the phone or if you started a chat session, you'd have to start the process all over from the beginning. Jacada does not want you to do that. We don't want your customers to experience that disconnected customer service experience. So when we create these interactions using your business rules and when we present them to the users, and if they get to a point where they either need to or want to speak with someone, either through chat or through voice or whatever channel, we're going to seamlessly hand that information right into your contact center agent who's going to be using your customer service desktop or one that we provide, it doesn't matter. We're going to actually hand that to them in full context so that the moment the call begins, they already understand why the individual is calling and, more importantly, what they've already tried to do. And in that moment, that individual can then complete the transaction, update the necessary back-end systems, thus fulfilling the complete life cycle of that particular process. And hopefully you'll kind of see that that takes us through the full life cycle. So you'll notice thus far that I've not really talked about any products per se. I've kind of alluded to some. But let's decompose this just a bit so you can get a sense for what those technologies look like and what does that mean to a business user. Of course, at the appropriate time, we're happy to share this with whomever on the technology side you would deem appropriate. But for our audience today, I really wanted to keep this from a very business-centric perspective. So let's talk about the very first step, defining business rules. So anyone in business knows what this in the middle of the screen is. It's a flow chart. And essentially we're saying using the same type of logic that you use to create flow charts, you as a business person can define the rules that will actually initiate the business process. Okay, and you can see the link, the message that would be generated and sent to the member. There's no PHI in there. It's just an information and an invitation to begin an interaction in a secure capacity. This is the tool. It's called Jacada Workflow. You can see pretty much the workflow process defined here. It's very business friendly. Business user builds the interaction, hands it off to IT for installation on the server, and it's up and running. How robust and how complex, of course, you guys can determine. But at the end of the day, it has a business focus to allow you to define the processes that make sense for you. So at the highest level, remember our roadmap at the beginning, we talked about struggling to sell and service individual policyholders. I hope that I've given you one good example for how you can proactively reach out to your individual holder, your individual members, and begin a proactive notification using our Jacada workflow process. There are many, many other examples of how you could use the technology, and of course there are many other examples for how you can complete a full customer service lifecycle. Wanted to give you one very relevant example. So let's continue on. What about that interaction that the member actually receives? What does that look like? How does it work? Well, you can see our gentleman here holding up his smartphone, and it's really just exactly as simple as it looks here. It's a series of steps that are designed specifically, in this case, for a smartphone, but you could deploy this in mobile. You could deploy this on your web self-service. There will even be a day, perhaps, when you'll see something like this deployed inside your vehicle or inside of maybe a small medical device. The connected world will allow this type of interaction to be presented in more and more avenues. Okay. In this particular case, this is a product that we call Jacada Visual IVR, and it allows us to take an existing interaction that you may already have in your IVR system and present it visually here. And the consumer can interact with it how they choose. Now, if you think about, I've given you one example of notifying a customer or allowing them to locate a physician, but the fact of the matter is there are plenty. I've given you an example here of showing a member a map for how they could actually find their way to a provider, but there are any number of use cases. So I've given you a couple examples. I think a couple that came to me would be notifying a member that they could register for a local health screening that's in their neighborhood. Or maybe there's an air quality alert or a pollen count alert, and you know that an individual member has certain susceptibility to those issues. Then you could certainly send them this type of interaction. Or it could be as common as a past due reminder and payment collection, or maybe just an appointment scheduling reminder. Any number of interactions. This is the product that you actually use to build that interaction. This is the interaction designer. You can create, here again, using a very business-friendly process to build out what looks like a workflow. It's all rules-based, so all these events happen based on the rules that you define. It has built-in reporting, and it's extremely easy to change. When you want to make a change and say yes instead of no, or go left instead of right, you drag the lines, you click the box, you make a few changes, you click publish, and you can literally have that change deployed in your environment in a little less than a minute. Now, however many approvals you want to put in that may delay that, but that is completely up to you, and we certainly support all the different approval levels that you would expect for a product that is this powerful. Conversely, perhaps you don't actually want to go through the process of building these interactions. Perhaps your IVR, which is your voice response system, in case I'm using a term you don't know, that's whenever you pick up the phone and it asks you to press 1 for accounting, press 2 for the emergency room, whatever, that's your IVR system that's doing that. We can take that existing logic using all your existing technology, and we can create these visualized interactions on a smartphone or on a web self-service site using all the same technology, all the same hardware, all the hard work that you've invested to understand that logic, and we can render it visually so that your members can interact on their terms. If they don't want to call the IVR, they don't have to. They can go in and visually interact with your company using that process. And here again, it's very rapid deployment, and probably one of the nicest things, when you change your IVR process, our process changes with it. You're not maintaining it in two places. They're both individual and discrete. Or I'm sorry, they're both tied together. Tied together. So what does that mean from an end user? I ventured off just for a moment to tell you a little about the technology. Here's the payoff. Remember a while back I told you, don't lose this point? Here's what this looks like for the end user. Imagine you've gone through the process of trying to change your primary care physician. And let's say you got it down to between two individuals and you couldn't quite make the determination, primary care provider, you couldn't quite make the determination of, well, do I want to go with Dr. A or do I want to go with Dr. B? and I think I want to talk to somebody, but I don't want to go through that whole process again. Well, using Jacada's visual IVR, you can actually take the customer right up to the point where at any point you choose, they can reach out to the contact center and they can initiate that interaction. Okay? Now, they can reach out by phone, and at the time they do, they can immediately find out what the hold time for that particular queue is, or they can schedule a callback, or if you guys use a chat mechanism, we can integrate easily with that and actually initiate a chat session. The point is, the consumer, the member, gets to decide how the interaction is going to transpire. They get to choose how and when and where they actually begin that interaction. We're putting power back into the hands of the customer who likes to be king instead of assuming that we know how they want to engage with us. And that's only half the equation, because remember, we talked about the fact that customers want to be able to make all these choices, but perhaps at this point you're saying, we already do things like proactive notification. We're already sending these email messages out. Maybe you're already sending text messages out. How are you connecting them back to the contact center when the time comes? Using the Jacada technology, when they actually call back into the contact center, you remember that process we defined at the outset that says, here's how we're going to engage the customer. We're calling them because there's an alert about their asthma, and there's a pollen count, or there's a pollution count that's high today, or maybe it's some other proactive notification. Maybe you're calling about a local health care screening. When that call comes in, your customer service representative will know what triggered that process, and they're going to know the actions that were taken by that member before they ever even picked up the phone. So we're going to know who is calling, we're going to know why they're calling, and most importantly, we're going to know what they've already done. Now, I want you to think about your last call to a customer service representative. Typically it goes, you get through the IVR, you spend a minute or so telling them what language, why you're calling, what your member ID number is, and even once you talk to somebody, you spend the first few minutes verifying who you are, and then you spend the next several moments explaining why you've called. From a customer perspective, none of that adds value. All you've done is facilitated getting connected to the right customer and hopefully passing a little bit of information in. Jacada basically uses our Interact platform to manage all of this. I'm going to talk a little bit about the technology just for a moment. You've seen in the bottom left-hand corner how we can use your existing IVR, or you can design those interactions using a drag-and-drop template. Our engine interprets that and allows you to present that across all these different channels and any other channels that might come along in the future. And we pass all that information directly to your customer service agent, your contacts, who's in your contact center, or even your back office. Not only that, not only do they get the information on their screen, but we're passing the phone information as well. So they're contacting, they're getting routed to the correct agent based on the rules that you define in your telephony system, and we're passing that data. And of course, as you would expect, all that information is available for reporting so that you can understand who's going through the process, what choices are they making, how long did they spend there, where were the bottlenecks, everything you would expect in a heat map like what you see here. And so at this point, I've taken you through how to facilitate customer service interaction of a full lifecycle nature using proactive notifications. And I've shown you how we can connect that interaction back to the contact center, carrying all of that information that was captured during that interaction and passing that so that the agent has that. So great, now the customer service agent is ready to begin work, right? And so this is what they're faced with. We call this desktop complexity. And so, it's great that we're passing all this information in. Perhaps you already do some of that. I don't know if you guys are familiar with the term screen pop, but your traditional voice response system will provide a screen pop telling you maybe the customer's account number or maybe even looking up their name. but it's certainly not going to tell you what they tried to do on their website. Or you might even have a whisper, something that whispers into the agent's earpiece the name of the customer or why they're calling, or perhaps what brand they're calling on. Clearly, these are helpful. Clearly, they're not sufficient. What Jacada proposes instead is a unified desktop, and we actually invented this, I guess, about 10 years ago, the concept of the unified desktop. We have a number of customers who are using this. It's a structured way to present all of this information in a way that agents don't have to swivel chair or alt-tab back and forth between applications. The most important things are right there within easy hands reach. And it's really an effective way of making your customer service representatives more effective. But, you know, I'm hoping that you guys already have a unified desktop in place of some sort. If not, we'd be happy to talk to you, but you know that we know a number of companies do have a customer service desktop. So I don't want to focus so much on the unified desktop. I really want to talk about the left side, and that is the member verification, which some of you already are doing through your IVR process and through the screen pop. But as I mentioned before, what about caller intent? The caller wanted to call about confirming eligibility and check they've done it, and they got into the primary care provider change, but they didn't complete the process. Wow, what a really great clue for how the agent can immediately begin helping the member when they call. And we can even bring up what records they accessed, what other information did they research while they were on your customer service website or on the smartphone. In this case, we know that this individual was trying to change PCP. They looked at Mr. James Naismith in Alberton, Massachusetts, but ultimately they couldn't pull the trigger or chose not to. Now I can engage with this customer in a very meaningful way and connect the dots for that full lifecycle customer service. And in so doing, we actually enable a number of other opportunities, such as the screen pop, which is displaying the customer desktop in full customer context. We can also display care gaps if you're not already doing that. That's certainly something that can be displayed and configured here. You can determine the appropriate call flow to display for the agent based on the type of call that's come in. And of course, you can make recommendations about the next best action. And we'll talk a little bit more about that last topic in just a moment. As a result of that, we've now covered our third topic, which is customer service desktop complexity, and we're proposing that you use a unified desktop and all of the capabilities that come along with that. And then our final topic that we wanted to discuss is this idea of real-time process guidance and next best steps. As I mentioned, it's very likely that some of you already have customer service desktops, and yet there are still times when you really want to make a change that'll help the agents understand how to interact with the system better, but the lead time to make these changes is measured in weeks and months to request a change to IT, and oftentimes the need for that change is gone by the time it can get implemented. So Jacada proposes to use our advisor product to basically enable real-time customer guidance. It works on top and with your existing applications. So if they're already using, whatever healthcare IT system, we can integrate with that and nicely show these updates right on top. And here again, as is the case with Jacada, business gets to define when the interactions occur and what they show. So we provide you with real-time process guidance. We display the next best action, and we help you enforce rules, and business decides when and where they appear. And in so doing that, we've covered our last major topic, which is the lack of guidance to customer service reps, real-time process guidance. Now, perhaps you've noticed that we've gotten progressively more narrow in our description of the problems we're trying to solve, and that was intentional because I wanted to start off really tackling the big issue, which was the full lifecycle customer service. I want to pause for a moment now and transition over and talk about what does this mean in practice for some of our members of the audience. So in the case of member services, and you could use provider services here, there are some very specific examples where we can help and where this type of technology can be useful. Think about the proactive notifications is very valuable in encouraging desired behaviors. You know, healthcare insurance has the added burden of not only providing insurance, but actually trying to reduce cost and provide better health outcomes. And what better way to do that than by advising your members on a very individualized basis with information that's helpful for them. Now, just to be clear, I have a chronic condition around asthma, and so occasionally my healthcare provider will send me a little notice or a pamphlet about asthma and how to avoid it. And about once a year I'll look at it, and the other 3 times they send it to me, it promptly goes into the garbage. It's not really a channel that I want to receive information on. In fact, I hate all forms of physical mail. I would much rather see a very specific targeted notification that tells me the air quality today is red in metropolitan Atlanta and I should avoid outdoor activity. That's actionable information, and it's given to me in a way that I prefer. So encouraging behavior is a great example of how you can actually, traditional healthcare companies can help establish behaviors. You can enhance self-service, as we've already shown, by creating these interactions that are much more robust, and you can start calls that are delivered to your customer service reps in context so that the customer service rep already knows why the customer is calling. For those of you who might be in the managed care space, you have a particularly high burden about understanding high-risk populations, how to better serve them, and in some cases even how to identify them. So imagine your customer service reps, how many times they're on the phone with a high-risk member and you don't even know because you didn't ask the right questions, or certain triggers hit that should have indicated that this person looks like they may, they're scheduling time with the OBGYN, and yet they've not, done some of the other things that you would expect for a prenatal visit. So identifying high-risk populations and helping to serve them, and then also just expediting provider claims inquiries. I can't tell you the number of times I've sat side by side with agents on the phone as the providers just list claim after claim after claim, where the member's trying to rapidly pull each claim up, explain to the provider what's going on, and then appropriately disposition. We can absolutely help by automating a lot of those activities. For those of you on the I'm sorry, got a little ahead of myself. There are a few pieces. Each of these can, of course, lead to improved member satisfaction, better health outcomes, reduced average handle time, and if you don't know what that means, talk to your contact center people. They will absolutely know what that means. It's the amount of time your member services reps are on the phone. We can help you with call deflections so that more of your members choose to self-serve rather than speak to agents. And we can help differentiate your company from your competitors, because I've worked with enough other healthcare companies to know that these types of topics are very much on their forefront of mind, and they are being implemented. Now, we move over to sales and retention. As I mentioned, obviously, you're in a new world in terms of trying to market and sell to the individual. So one of the benefits of using technology like what we've talked about today is to recognize the individual for who they are, not a broad demographic group, and then being able to tailor that pitch based on the individual, and then, of course, engaging the prospective member, here again, on their terms, not the channel that you decided for them. And then on the retention side, insofar as you can ensure consistent answers across all channels, whether it's voice, whether it's chat, whether it's self-service, if your members are consistently getting the same information, and when they change channel from voice to chat or vice versa, they don't have to start over again, you're going to lose less members, because that's an improved customer experience. And of course, these technologies allow you to handle objection handling, so that as you have a retention group and as they're trying to keep members re-signed with your plan, it'll give them the necessary information to help answer specific objections, and it can do it in a just-in-time capacity. So I hope I've given you some useful insight around how the technology can help you provide the full customer lifecycle service. And I hope I've given you some of the benefits that can result in how consumerization is actually driving this behavior. We talked about some of the benefits there. I want to leave you basically with this parting piece of information, which is here are the problems or the solutions that we see healthcare companies looking to implement. Here are the products that we're proposing actually help solve this. I will be making this information available. We'll send it to you after the webinar. So you'll get this slide, if nothing else, that'll basically give you the links to each of these products and some information, some videos, case studies, a wealth of information about how you may choose to use this as you progress down the path. So that pretty well concludes the presentation. I hope this has been helpful for everyone. And with that, I will pass it over to Mr. Lee, and he's going to take us home.
Okay, thank you for your valuable insights on engaging and retaining customers, Clay. Now we will allow Clay to answer as many questions as possible from the Q&A window, and the remaining will be responded to individually via email or phone call after the event. So Clay, I think you can see the questions in the Q&A window, so I'll let you select the questions to answer.
Great, great. Yeah, so I think the first thing that I saw was, and we spoke to this briefly during the early part of the call, which is, what about HIPAA compliance and private healthcare information? How do proactive notifications work? Well, as I mentioned, the Jacada platform, Interact, actually does allow you to create secure interactions. We're not suggesting that you send any private information via SMS or really any unsecure channel. That's strictly, something that we want you to manage inside of our secure platform. Now, there is a broader conversation that needs to be had, and I'm really glad that this question was asked because this is something that I want to make sure that companies are considering. I have heard from the horse's mouth through direct discussions that many companies are struggling with where's the line between providing close customer service, interactive customer service, and breaching guidelines around sharing personal health information. And for sure, the penalties are pretty steep. Nevertheless, companies are taking a fairly fluid approach to trying things. And what I'm hearing is it's a judgment call, and companies are testing the waters even now to see what makes sense. So my suggestion to you is, obviously, the legal team, the compliance team will have a perspective, but make sure your marketing team's involved and see exactly where those topics land, and then maybe you can start testing the waters with something like what we showed, where you're sending a proactive notification, but, A, it's opt-in so that the member designated that they do want to receive it, and B, you're ensuring that there's no private information being divulged in the message itself. So there you go. That's the first question. And let's see. Okay, here's another one. It says, we are already sending proactive messages, and how is this any different from what you're already doing? For sure, proactive notifications are not particularly new. There are many ways to do that. Many companies do that using their homegrown solutions. Really, the piece that makes what we're proposing different is not necessarily the sending of the message. It's two pieces. One, it's allowing business to define the rules for when that happens, and business being able to implement and deliver those rules so that they define the process by when that happens. And two, and probably more importantly, it would be having the ability to connect that process back to the customer service contact center when the time comes. That's a really important point, and that's not just healthcare, by the way. Jacada is engaged with a number of Fortune 100 companies that are actively exploring this concept of connected self-service, and we are seeing a phenomenal amount of interest around that. And let's see. The third question is, which of these products are used in production in healthcare? Oh, wow, straight to the point. Okay, well, the good news is just about all of them, and I will explain. Workflow, which you saw, helps you define the rules for when events happen, and Jacada Workspace, which is the unified desktop, and Jacada Advisor that provides the real-time guidance are all being used by healthcare companies today, even as they're trying to manage some of the consumerization challenges that we spoke of. Visual IVR is a brand new product, but it is built on technology that is quite mature, and that is the product that we're seeing the most interest from in the big Fortune 50, Fortune 100 companies and in the healthcare space. I have several prospective healthcare companies that you all probably know that are actively interested and are pursuing visual IVR. I think we have time for perhaps one more, Lee, so we'll wrap this up. Okay. The question is how is healthcare reform driving consumerization? Well, so the Affordability Care Act really is hitting us in a couple of ways. First of all, it's bringing a younger demographic to the table with the individual mandate. So, of course, you know, the younger generation has this higher expectation around being able to individualize their experience with customers. So that, of course, is impacting it. The transition from group insurance down to the healthcare exchanges and trying to compete on a level playing field for the individual, not necessarily for the group insurance, is certainly driving consumerization. So both of those factors, I think, are playing heavily into this. So I think that pretty well wraps us up. I think that's all our questions for today. So Lee, if you don't have anything else, I think we're free and clear.
All right. Well, that concludes our webinar on how to engage and retain customers. Thank you again, Clay, for your valuable information. If there are any other questions that we were unable to answer during today's session, we will respond to those directly after the event via email or a phone call. We hope that you have gained valuable insight into how to engage and retain customers and how easily you can utilize that insight to enhance your organization's customer service. A replay of the event will be available soon on Jacada.com. If you would like a copy of the slide decks, please contact me directly, ljudge@Jacada.com. Once again, thank you for attending today, and please visit us again at Jacada.com and have a wonderful day.